Welcome to the National Health Insurance Administration. This is an overview of Taiwan's National Health Insurance Program, which was launched on March 1, 1995, to provide health insurance for all Taiwan residents. Here's today's agenda. There are over 23 million people living in Taiwan. Over 17% of the population is over the age of 65. As of 2022, GDP per capita reached $32,625. Taiwan's national health expenditure was 7.47% of GDP in 2022. Life expectancy was 83.3 years for females and 76.6 years for males. Before our current national health insurance, Taiwan had 13 different social insurance programs, covering specific groups like labor, government employees, and farmers, with provisions like health care and pensions. However, only 59% of the population was covered in 1994. Since its establishment, the National Health Insurance has consolidated the health plans of the aforementioned insurances, providing nationwide health protection to Taiwan citizens and international residents. In order to improve the quality of health care, ensure the soundness of finance, and encourage public participation, a second-generation national health insurance was launched on January 1, 2013. Taiwan's healthcare system is mainly dominated by the private sector. Hospitals adopt the closed-staff model, and physicians are primarily salaried by hospitals. There is no gatekeeper system to screen patients. Patients can go to any clinic or directly visit any hospital without a referral. The volume of hospital outpatient services is high as a consequence. However, healthcare is usually provided in a timely way, and waiting time is negligible. Here are the main characteristics of Taiwan's NHI. NHI is a compulsory program, and all residents must enroll. The National Health Insurance Administration is the sole authorized agency to administer the program, including premium collection and medical payment reimbursements. Healthcare coverage is comprehensive, and people must pay a co-payment when seeking healthcare. Though it's voluntary for healthcare providers to participate in this program, about 92% of providers nationwide have contracted with the NHI. Providers are reimbursed through plural payment programs within the global budget payment system. Premium subsidies and co-payment waivers are granted for disadvantaged individuals. Our national health insurance has earned a strong reputation among the people of Taiwan and is widely regarded as one of the nation's most esteemed public programs. The public satisfaction rate has shown significant improvement, increasing from 39% in 1995, the NHI program's inaugural year, to 61% in its second year. It has continued to rise ever since, demonstrating consistent growth, climbing from 81% in 2015 to 91.2% in 2023. The NHI program has not only established a secure healthcare network for all residents in Taiwan, but is also renowned internationally for achieving universal health coverage and providing comprehensive healthcare at an affordable cost. People are ensured easy access to healthcare providers regardless of their ability to pay for care. Public satisfaction remains high, and medical quality is consistently ensured. Our national health insurance is primarily financed by premiums, including general and supplementary premiums. Each person shall remit the general premium according to the premium formula or fixed figures. In addition to the general premium, a supplementary premium has also been collected since 2013. The insured will be charged a supplementary premium of 2.11% on certain incomes received, including large bonuses, professional fees, part-time wages, stock dividends, interest income, and rental income. The insured are classified into 6 categories and subject to different premium calculation bases and contribution shares depending on the category they belong to. Most salaried employees belong to Category 1. They have to pay 30% of their premiums. Their employers pay 60%, and the government the remaining 10%. The government subsidizes 100% of the premiums for low-income households and military conscripts. Inmates are also covered under NHI, and their premiums are paid by the government. NHI premiums are calculated on the basis of regular salary income. In the first decade of this century, however, salary income declined as a percentage of national income, leading to premium growth lagging behind income growth and funding shortfalls. The introduction of the supplementary premium on various types of income other than regular payroll has alleviated perennial financial problems. Patients have to present their NHI card when asking for NHI health services. The NHI card contains records of a patient's last 6 visits, drug prescriptions, drug allergies, catastrophic diseases, consent for organ donation, consent to palliative care, and consent to a DNR order. In recent years, cloud technology has been applied, turning the NHI card into a key for additional and powerful functions. In addition, the digital NHI card is extensively utilized in home healthcare, telemedicine, and video consultations. Our national health insurance provides comprehensive benefits that cover inpatient care, outpatient care, drugs, dental services, traditional Chinese medicine, daycare for the mentally ill, and home health care. Expensive health services, such as dialysis and organ transplants, are all covered. The insured must pay co-payments when they use medical services. The co-payment is partially waived in cases where the hospital outpatient visit is arranged through a referral. To ensure that people who really need health care do not lose access because of this cost-sharing mechanism, individuals who meet certain conditions are exempt from making co-payments. If those who are insured require hospital stays, they will be charged to co-insurance, and the rate varies according to the length of their stay. However, this co-insurance was capped at $1,563 per stay for the same disease in 2024, and $2,625 accumulated in 2024, regardless of the disease. The average utilization rate for NHI outpatient services in 2022 was 14.28 visits per person. Those visits include visits for dental care and traditional Chinese medicine. For inpatient care, the average utilization rate was 13.22 admissions per 100 persons in 2022. This number of outpatient visits is substantially higher than that seen in many OECD countries. Since the implementation of national health insurance, the contracted rate of medical institutions has consistently hovered around 92% of all healthcare institutions nationwide. All hospitals are contracted under national health insurance, achieving a 100% contracting rate. Among clinics, dental clinics have the highest contracting rate, reaching up to 98%. Since the inception of NHI, the National Health Insurance Administration has reimbursed healthcare providers based mainly on a fee-for-service payment system. In order to better control health expenditures, the NHIA introduced global budget payment systems, including global budgets for dental care, Chinese medicine, clinics, hospitals, and dialysis. To further rationalize the reimbursement of health services, a Taiwanese version of DRGs was initiated in 2010. To enhance healthcare quality, specific projects have been implemented to address diverse needs. For example, the Integrated Delivery System Plan, initiated in 1999, has improved healthcare in mountainous areas and on offshore islands by dispatching doctors to these areas. This plan is undertaken by metropolitan hospitals, cooperating with local healthcare providers to provide tailored healthcare services according to local healthcare needs. Pay-for-performance and pay-for-value projects for specific diseases have been gradually implemented since 2001, such as for diabetes mellitus, chronic kidney disease, and metabolic syndrome, making healthcare more effective. These patient-centered initiatives ensure better patient access to healthcare. One of the core values of Taiwan's NHI program is to remove financial barriers in healthcare for people through the NHI Fund. This explains why the NHI can cover catastrophic diseases, such as patients with hemophilia, who spend 82 times as much as the average patient. For people who are less fortunate, the government provides several types of assistance to make sure they have access to medical services, such as premium subsidies, financial assistance for the poor, and medical assistance for the disadvantaged. Since 2016, the policy of unlocking NHI cards has removed the fetters imposed on financially disadvantaged people who fear seeking medical care because of overdue premium payments. Originally starting in 2013 under the name PharmaCloud, the NHI MediCloud system has provided health professionals with patients' health data and images to ensure drug safety and enhance healthcare quality. During visits or hospitalizations, health professionals can view patients' records of medications, surgeries, tests, and exams, as well as medical images and drug allergy information through a secure virtual private network. Currently, the system achieves an impressive 90% inquiry rate and 98% usage rate among medical institutions, handling around 36 million inquiries monthly. Since its inception in 2014, My Health Bank has been dedicated to providing individuals with an online health information system accessible via mobile phones and computers. It empowers users to inquire about personal health data, medications, tests, and exams. During the pandemic, it played a pivotal role in managing the distribution of supplies and medical resources, such as face masks, vaccine administration, virus testing, and access to rapid test kits. As a result, user numbers surged from 1.6 million in December 2019 to 11 million by December 2023, nearly 50% of the population. In 2020, Taiwan's NHI initiated reimbursement for telemedicine services, integrating them into the IDS program to enhance healthcare access in remote and mountainous areas, thereby promoting localized healthcare. As of November 2023, 84% of mountainous areas, offshore islands, and remote regions have joined the telemedicine reimbursement program, in addition to 9 acute severe care referral networks. Based on digital infrastructure, telemedicine will be facilitated through digital devices and medical equipment equipped with Internet of Things (IoT) technology to provide smart remote healthcare applications. Currently, teleconsultations are conducted via video between endpoint clinics and telemedicine providers, offering specialized consultations and emergency services. In the future, telemedicine will expand to include residents in long-term care institutions, patients receiving inpatient care at home, individuals in need of home health care, and patients undergoing dialysis at home. This expansion is expected to adopt the patient-to-physician model, adapting to the new normalcy emerging after the COVID-19 pandemic. The NHI digital transformation is currently adapting to the ever-evolving needs of the digital age and enhancing NHI services. By adopting cloud technology and obtaining individuals' consent, the NHIA is able to collect diverse health data, connect with healthcare providers, other government agencies, and industries, and offer more extensive services to the public and its partners. To facilitate patient-centered and valued healthcare, the NHIA will employ innovative transformations to enhance the NHI systems, focusing on digital transformation, service optimization, emerging technologies, and innovative models. In pursuit of health for all and sustainability, the NHIA is extending healthcare beyond hospital walls, proactively providing healthcare in communities and homes, and making it more equitable and accessible. To foster holistic care rather than mere healthcare, the NHIA is also encouraging preventive healthcare and facilitating the integration of long-term care. Furthermore, not only is quality healthcare emphasized, a value-oriented payment system is also being established to elevate healthcare. We welcome you to visit our website at www.nhi.gov.tw for updated information. Thank you for watching. We hope you enjoyed today's presentation.